Hello and welcome back to Level 3 Health and Social Care, Unit 6, Stroke. Okay, we're looking at Part 2 in Week 1, where we're going on to look at the difference between left-sided CVA and right-sided CVA, and I'm going to explain that to you. Okay, the objectives of this, we're focusing on two criteria from your assignment. 1.2, discuss the signs and symptoms of left and right-sided CVA. So you're going to differentiate a bit between the two of them. And analyse the reasons for different presentations, the signs and symptoms with regard to physiology of the brain. That's a bit of a complicated sentence, but what it's really saying to you is to, when you're writing it, just give me some examples of why different parts of the brain might have different signs and symptoms when they're affected, okay? Because different parts of the brain have responsibility for different areas. So we'll go on to talk about that in a minute. And this will be a little bit of a refresher on some of the things we discussed in the last PowerPoint. But it's important that you're clear that you'll be working with lots and lots of people with stroke. Especially if you're working in an older person's service, which a lot of care homes are. So you'll be coming across lots of people with stroke. So it's really good to be confident about the sort of different types of stroke and what you're expecting to see. So it's good to sort of keep reinforcing it. Okay, the effects of stroke, well, they vary from person to person. You can't really predict how badly or lightly somebody will be affected. Um, Based on the type, be it an ischemic or a hemorrhagic, there's a different level of severity depending on what blood vessel is affected as well, where it is, how many strokes people have had. Some people have more than one, and if they do, it becomes, more and more difficult for them to recover. Brain's very complex, and as we know, each area of the brain is responsible for specific function. So when an area of the brain is damaged, the loss of normal function of part of the body may occur, and so one of the results may be a disability. So it may be a problem with walking, or maybe some left-sided weakness, or unfortunately some people, their arms could, after a quite severe stroke, their arms completely dead, and they often can't recover anything, and their legs as well. So it can actually leave people with quite a disability. But first of all, we've got a little worksheet in extra reading about labelling your brain, okay? And this is just a little bit of revision from the last session that you looked at. So I'd like you just to take a few minutes out just to have a look at that worksheet and just label the brain to make sure you can remember all the different bits and what they are. Okay, well, now you've labelled your brain, we're just going to review it. So there are three main areas, as we know: the cerebrum, which is the small bit at the back, and the cerebellum, which is the top and the front, okay, and the brainstem, which is at the base. And also, if you're looking at that picture there, which is very helpfully pink and blue, you can see that not only are we got these three different bits here, it's actually, the brain is actually almost in two separate sections, okay. Two hemispheres, they're known as the right side and the left side, okay. So if you pick a brain up and look at it, it's sort of split down the middle, okay, and one hemisphere can be damaged and the other side not be damaged. It really depends on what has happened to it. So just reminding us, there's quite a nice picture. You can see the cerebrum, a part of the brain that occupies the top and front portion of the skull. What does it control? Lots of things, really. All the different lobes, frontal lobe, parietal lobe, temporal lobe, occipital lobe, and limbic lobe. So we've got a bit more detail there. And the fact that it's in 2 hemispheres. Okay. So we know the cerebrum controls movement and sensation, speech, thinking, reasoning, memory, vision, and emotions. Quite important. So depending on the side of the cerebrum that gets affected by the stroke, any or all of these functions may be impaired. So it could be movement, speech and language, eating and swallowing, vision, cognitive, that's your thinking, reasoning, judgment, memory, perception and orientation, so knowing where you are, what you can see, self-care ability, bowel and bladder control, emotional control, sexual ability, and there may be some other specific impairments as well. So when it's a right hemisphere stroke, so the right side of the brain, so it could be anywhere in the cerebrum, but on the right side, okay, the effects can be, have a good look at the graphics, really. You can see that when the right side is affected, the weaknesses or the impairment show on the left side. That's just the way it works, okay? So left-sided weakness or paralysis and sensory impairment. So this side is affected and this side is impaired, okay? And the same the other way around. So the sort of things you'd be looking for is either this left-sided weakness, like not being able to move their arm or their legs, or that can be completely heavy, completely weak, no strength at all, or it can be, you know, just reduced. Visual problems causing an inability to see the left visual side of each eye. Okay, so the eye actually is split up into 2 as well. So the right hemisphere stroke will affect the left side of both of your vision. Spatial problems with depth and perception, directions such as up and down, front and back. People can get confused and get it the wrong way around. Inability to recognize body parts. Sometimes people don't recognize their hand as their own. They think it's somebody else's. That's very strange, but you can imagine it's quite frightening as well. Inability to understand maps, find objects such as clothing or toiletry items. And you can suddenly see this if you've been working with someone in a care home, and you know, every morning you say, oh, you know, go and find something out of your wardrobe, but you want to pick on, or you know, or you talk about what should I wear today, and maybe the lady says, I'll wear my red dress. You say, okay, you want to pick it out from the wardrobe then, and she'll look to her wardrobe, but she can't find it because she can't see it anymore. She just doesn't know how to find it. And you might see them sort of standing there, and you might say, go to the wardrobe, and they might not even be sure what the wardrobe is. So if you take them to the wardrobe, you say, now look out for your red dress, she might see loads of dresses and not really be able to pick out because something's not working for her. Memory problems, so if someone who maybe had a good memory one day after a stroke, they might forget your name, they might forget their children, they might forget what they said to you the day before, so various things. Now that is also a problem of aging. We will discuss that when we look at dementia, but it can be an effect of stroke as well. So when you're looking at the 2, you've got to sort of delve a little bit deeper. Behavioural changes, often it's lack of concern about situations. They're a bit inappropriate, or they might be impulsive when they were cautious before. They might lose a bit of fear of things, might cross the road without thinking about it, those sorts of things. So they become a little bit risky in that sense because they're not really seeing the risk in the same way. Okay, so the effects of a left hemisphere stroke are similar, but there are differences. As you can see, the list is not quite as long and there are slight differences in it. So again, if there's a left hemisphere stroke, then the weakness will all be on the right side. So if someone suddenly, you know, can't move their arm and their leg and they've got paralysis down the right hand side, then you know the stroke has been in the left hemisphere. They have more problems with speech than on the other side and understanding language. They start to get all their speech topsy-turvy, or they can't remember the words for something, or you can ask them a question and they don't really know what you're talking about when they did maybe a couple of days ago. Visual problems are the other way around. They lose the inability to see the visual field on the right side of their eye. Okay. So again, it's all the weaknesses happen to the right. Impaired ability to do maths. So if you ask them to do some simple sums, they might find it more difficult than they had done before. To organize, reason and analyze. So thinking things through, working out what's the logical answer, they might find very difficult. Organizing their thoughts, getting them in the right order. So you might ask them to explain you how they went and did something. They might start getting the order of what happened a bit topsy-turvy. Behavioural changes. Now, where our right hemisphere folks are impulsive and a bit thoughtless and lose their fear, these guys are the opposite. They're much more cautious and hesitant. So maybe something they were confident at a couple of weeks ago, they now no longer are. So you'll see that as a bit of a behavioural change, and they might sort of become low and a bit depressed, or glum. Impaired ability to read, write and learn new information. So whereas before it was more about speaking, although there will be some speech problems here as well, they're actually sentences they could write maybe a few days ago, again they might completely be unable to write, or they might write a little bit and get the words mixed up, and they don't retain new information. So if you give them something, if you talk about something that they might have known for a long time, they might have that. But if you show them something new, I don't know, teach them a new skill or something like that, or how to do something on their phone, they probably won't be able to retain it, and they struggle for the learning process. And memory problems as well, very similar. That one's similar. They might forget what you told them an hour ago. Okay, so you can see that left and right hemisphere, they have similarities, but there are some subtle differences. So when you're answering the question, it's important that you show the differences more than the similarities. Okay, you might want to do a sentence about the similarities, but then pick out those differences. And of course, the biggest one is weakness on the opposite side. So left hemisphere stroke, weakness on the right hemisphere stroke, weakness on the left. So you've got to make sure, if you get that wrong, you will lose marks because it's the most obvious part of all. So affective stroke in the cerebellum. We know the cerebellum is a small bit at the back, as you can see in my graphic. It receives sensory information from the spinal cord. Try and remind yourself, what does it do? We had a look at it in our last session. Have a think. Take a moment, see if you can think about what it does. Okay. Helps coordinate muscle action and control, fine movement, coordination and balance. So it's a lot to do with actually getting around and doing things. So what are the effects of strokes in the cerebellum? So if you think about what I've said, it's to do with getting around, doing things. So some of these common effects would be affect the way you walk, problems with coordination and balance. Okay, so people are wobbly, they might need to use a walker afterwards because they're balanced, or they might have falls easily, or they might sort of feel a bit nervous about actually walking. Dizziness, they can suffer from vertigo, so the world gets a bit swimmy again, so they might need support when they're walking, or certainly using maybe a walking frame. They suffer from headaches, nausea and vomiting. So that's if you see those symptoms, one of the things it's worth testing for, especially if someone's a bit older, it's worth testing to see if there's been a cerebellum stroke, because it's not as obvious as the others because you don't have that weakness. Okay. But they tend to be quite severe, the effects. So the brainstem. The brainstem is at the base of the spine, as we know. It's above the spinal cord. Hopefully you filled that in on your brain sheet. So can you remember? Take a minute, see if you can remember what it controls. I'll just give you a moment to think about that. There's a bit of a clue in the graphics, really, where I've broken the brainstem up into its graphic. Okay. Fairly important, the brainstem. Take a minute, think about what it does. Let's see if you're right. So it's relevant for most of the body's life support functions, such as heartbeat, blood pressure, and breathing. So obviously a stroke in the brain stem is a bit worrying. It also helps control some of the major nerves. So eye movement, hearing, speech, chewing and swallowing. If those nerves are damaged, so is your ability to do most of those things. So you can imagine someone could be very, very unwell coming out of that. If you're breathing and your blood pressure is affected and your swallowing is affected, it could be quite serious. So what are the effects of a stroke on the brain stem? Some common effects include problems with breathing and heart function, being able to control your temperature, so they may be shivering uncontrollably when they're in a nice warm room, or the opposite, hot and sweaty when the room is sort of fairly fresh and cool. Balance and coordination will also go, a bit similar to our previous one. There will also be weakness and paralysis, but it could sort of be anywhere, so it might not follow the system. Chewing, swallowing and speaking, vision, and very often they lose consciousness and go into a coma. That's usually when you really know it's a brainstem, and then they will do an MRI or a CAT scan and see that it's a brainstem. Unfortunately, a lot of people die with a stroke in the brainstem, so they're generally sort of looking at this pretty much after, after the effect, really, because a lot of people don't recover. But some do, but they may stay in a coma for a period of time. So if you see someone lose consciousness like that as part of their stroke, it's a good chance it's a brainstem one. And they would really, they would treat it as is, because they might not have time to get an MRI, But as I said, unfortunately, it's very often fatal. Okay, that's the last slide for part 2. So that's the whole of week 1, really. And maybe do some extra reading on the side so that you can get quite confident with the different parts of the brain before we go on to the next bit. Okay, thank you very much, and I'll see you in week 2.